My name is Dr. Rick Braver. I'm a sports podiatrist here in Englewood, New Jersey, as well as Fairlawn, New Jersey. Yeah, basically, as a sports podiatrist, we see, and dealing with, having a very athletic population of patients, we see quite a few injuries that relate to, especially to women. One of them is heel pain. Some people consider this plantar fasciitis. A plantar fascia is a ligament that runs along the bottom of the foot. There's ligaments that go on the bottom of the foot here, and what they do is they get strained when the athlete pushes off. So here's a nice model here, and this band would represent the plantar fascia here. So this band of ligaments here goes from the bottom of the heel up towards the toes, and when the foot goes to excessive motion, usually when it collapses or has a tendency towards being a flat foot, it actually rolls downward. Particularly when you go to push off, now it rolls downwards, it pushes downwards, and it causes a strain to the plantar fascia, almost as if it's pulling off of the heel bone. And runners and people that do a lot of running activities, where it's more like field hockey, soccer, lacrosse, any sport where there's a lot of sprinting involved for a little bit of distance, as opposed to maybe basketball, which is very short bursts, the foot can toe outwards, and as the foot toes outwards, it causes even more stretch of the plantar fascia, especially from the inside edge or the medial edge of the plantar fascia, and that causes a strain. Again, it pulls off of the heel or away from the heel and causes irritation, which develops into inflammation and develops pain. So we have to go and treat that. And one of the ways we treat that is by first making sure that the bottom of the foot is very pliable, very flexible. So we roll the foot over a frozen water bottle, tennis ball, golf ball, anything to make it more stretchable, such as massage. But reality is the plantar fascia doesn't stretch. But we try to roll it over the golf ball or whatnot, so that it causes heat, which tends to increase circulation. Also, there's muscles above the plantar fascia that go into spasm during this injury. So by rolling the foot over these objects, it stretches out those muscles as opposed to really stretching the plantar fascia. So it loosens it up, it can break spasm, and that's why it's very helpful. That's one thing we try. The other thing, obviously, is supportive shoes. There's over-the-counter inserts we can put in those supportive shoes. We know that some of the soccer cleats, things of that nature, have very poor support. So we have to augment that by adding an over-the-counter insert. If that doesn't work, then they come to our office, and of course, we make something right in our office, fairly inexpensive, that goes in the shoes, and it stops the foot from collapsing down. And again, by supporting the arch and supporting the foot at push-off, we have actually, sometimes we put wedges in the orthotics, or these are the inserts we call them, under the big toe. It stops the foot from collapsing downwards at push-off, and that dramatically helps to reduce the pains people incur. So there's no more mechanical stretch of the plantar fascia when that occurs. Sometimes people come in and they can hardly get out of bed in the morning. When they step down, it's so painful, and of course that's because the foot at nighttime actually tightens up, it spasms. We call that reflex guarding. So it's important at that time to stretch it out, or put your foot in a heating pad in the morning to break up that spasm. In addition, if they're that painful, and it's really affecting the way that their livelihood is going, we sometimes have to give an injection. Injections reduce inflammation. So basically, I just wanted to show what an orthotic looks like. This is a full-length orthotic. Being full-length doesn't mean that it has a cover on it necessarily, which of course makes it full length, but I'm talking about the actual orthotic component, which has a wedge under the big toe joint. By having a wedge under the big toe joint, and there's nothing on this side here, but there's more of a wedge here, when we go to push off on this, I don't know if you can angle down this, when I go to push off on this, there's an actual wedge that stops the foot from collapsing downwards. Plus, being a sports orthotic, we need to offer some shock absorption. We don't want to take away from the shoe, which is providing shock absorption, but it's got to be semi-flexible. Right. The orthotic also has a deep heel seat, which means that when I put the heel into it, because it's custom, it cups the heel. And by cupping the heel, it prevents this teeter-totter effect of the heel bone, so that when the person's out there running, the heel can't be rotating too much, so it's not collapsing to the ground. So it actually cups the heel, actually keeps the fat pad of the heel encapsulated underneath the heel bone, as opposed to kind of spreading out when it lands. So it keeps the natural cushioning under the heel bone as well. So That's how we help with orthotics, which again dramatically helps reduce the amount of irritation to the plantar fascia.